Today, our group will compare between open surgery and robotic assist surgery. Open surgery has been widely used for many years, while robotic assist surgery is newer technique that use robotic system to assist surgeon. These two methods has differ in several aspects, including surgical technique, patient recovery, complication and safety, cost and infrastructure, and also surgeon training and access. Understanding these differences can help both patient and surgeon choose the most appropriate surgical approach.
A comparison of surgical options using the Da Vinci system to gain insights into when to use robotic platform in comparison to open surgical techniques. Traditional open surgery, in comparison to the minimally invasive nature of surgical techniques, utilizing the Da Vinci system, typically requires larger incision to allow for direct access to internal organs. In contrast, robotic platforms use small keyhole incision with surgeons controlling flexible arm from a master console. Key tools like tremor filtrations, 3D HD visualization, and EndoWhisk tech give doctor much better accuracy and wrist movement in tight space that human hand can manage.
I will compare between robotic surgery and open surgery when it comes to patient recovery. We have some study in 2023 show that robotic surgery has a small incisions. So it's just a few centimeters. It less stress and less trauma to your skin, your tissue, and also your muscles. Because it's so small, patient will experience less pain when it compares to open surgery. Actually, we have some studies about it. The studies show that patients who use an open surgery use around 180 milligrams of opioid to control their pain. But the patient who use a robotic surgery use around 150 milligrams of opioid to control their pain. Moreover, the patient who use robotic surgery has a shorter hospital staying and also have a minimal scar.
Now let's talk about complications and safeties. When comparing open surgery with robotic assisted surgery, studies in both liver cancer surgery and oral cancer surgery suggest that robotic assisted surgery is generally safer. For example, patients who undergo robotic assisted surgery tend to have a lower risk of complications after surgery. This includes severe wound infections, liver failure in liver surgery, and jawbone non-union in oral surgery. Another advantage is that robotic assisted surgery is associated with higher survival rates and lower recurrence rates. However, it's not better in every aspect. Robotic assisted surgery usually takes longer to perform, and it may also cause more blood loss during the operations compared with open surgery. So, overall, although robotic assisted surgery can take more time, its greater precision and better control of surgical instruments can help reduce complications and improve overall surgical safety.
Let's talk about cost and infrastructure of robotic assist surgery compared with traditional open surgeries. First, robotic assist surgery generally have a higher overall cost than traditional open surgeries. Traditional open surgery usually use a standard operating room and commonly available surgical instruments, which are available in most hospitals. In contrast, robotic assist surgery requires a substantial initial investment as well as ongoing maintenance, specialized equipment, and staff training. These requirements can become major barriers for smaller community hospitals. However, despite these higher financial costs, robotic assist surgery can provide important clinical benefits. These include lower direct hospitalization costs and improved patient outcome, which can be measured by using QALYs or quality adjusted life year. Moreover, in the study, we found that the number of procedures can also affect the cost. When the number of surgeries reached 300 cases, the cost difference between robotic and traditional surgery was approximately $1,416.69 per patient. But when the number of surgeries increased to 500, this cost difference decreased by 30% to approximately $973.38 per patient. This suggests that as more robotic assist procedures are performed, the average cost per procedure can decrease because the initial investment and infrastructure costs can be distributed across a larger number of cases. So in conclusion, traditional open surgery remains the most cost-efficient option, especially for hospitals with a limited resource. However, for high-volume center hospitals, robotic assist surgery may become a more economical viable option in the long term.
Hello everyone, today we talk about surgeon train and access. While both robotics assisted surgeries and conventional laparoscopy are minimally invasive, they are differ sharply in surgeon trains and performs. Robotics platforms are dramatically flatten the learning curve and also allow the trainee to master complex tasks like intracorporeal stutterings fast and with a fewer errors. Replacing rigid tools with rich articulated instruments that mirror human hands movement. Interestingly, in transitioning isn't seamless because surgeons often have to unlearn manual leverage before switching to the console. Finally, the economic shift is massive. Instead standing off statistics, exhausting postures, and surgeon overlaying comfortably seats, drastically reducing fatigue during long procedures.